We have Allison in the chair. Say hi, Allison.
Hi.
So we're going to use her lovely face to show you some of the common things that I will see in practice. So go ahead and lean your head back, Allison. Let's say you're doing a tox treatment on a patient. I always tell patients, hey, don't love it or hate it for 2 weeks. If after 2 weeks something's not right, come back in. Probably the most common touch-up I will do is somebody has a heavy brow, okay, which means that their brow is either pulling down or feels like it's pulling down. That means you did not treat the depressors adequately, and you need to add more volume to the depressors, okay? Remember, the depressors are pulling down. The depressors are the corrugator supercilii and the procerus muscle. So if she feels like the middle of her eyes are really heavy, I will put another 2 to 4 units on each side of those eyes to lighten it up and let the frontalis muscle pull up. All right. That's the most common. The second most common thing I will see is prior to any tox treatment, a patient will say, hey, I have one eyebrow that's a little higher than the others. All right. And I see that all the time, and it drives them nuts because especially like when they smile, it'll go higher or something like that. That tells you that the frontalis muscle is a little stronger on that side. So in those instances, I might put an extra unit over a high eyebrow. So maybe I'll do 1 unit on this side and 3 units on this side. So this side comes up a little bit, this side goes down a little bit, and kind of balance that out a little bit. So I will often fix asymmetries by less tox on one side, more tox on the other side to kind of balance out the eyebrows a little bit. Now let's say it's been a couple weeks that a patient comes in and they got this going on. Okay, well that's because you didn't inject far enough, close enough to the temporal fusion line. So then what I'll do is I'll have her lift her eyebrows up, and then I'll find the muscle and I'll inject 2 units right there. Now, 98% of patients' frontalis muscle goes from temporal fusion line to temporal fusion line. Okay, 2% of patients, the muscle wraps over the temporal fusion line. And on those situations, they almost always come back for touch-ups because both eyebrows will be high like this, because you'll actually see the muscle move on the lateral aspect of the temporal fusion line. Okay. In those circumstances, I'll inject past the temporal fusion line because that's the muscle I missed. And I will write a note in, always inject past the temporal fusion line on this patient in future treatments because they're one of the 2% that muscle wraps over the temporal fusion line. Okay. So that's a common thing I'll see as well. Another thing I'll see, especially with first-time patients, is we'll take care of all these lines and then they'll say, oh my gosh, now I have bunny nose lines. Give me a bunny nose. And they think you caused it. Well, guess what? You didn't cause it. It's the only line left. And now because it's the only line left, they're now noticing it. And so I'll go and I'll inject that nasalis muscle after explaining that, hey, you've always had those. It's just now they're the only muscles you have left that are showing any signs. So those are some very common tox things I see in practice: asymmetry, high eyebrows, low eyebrows, and you could definitely balance tox out with just injecting at all the right places. So hope that helps you. Now go seize the day.